In today's fight against healthcare-associated infections, otherwise known as HAIs, one of the biggest battles can be found at central line sites. The CDC reports an average of 250,000 central line-associated bloodstream infections, or CLABSIs, occur annually in the United States across all hospital units. These infections are associated with 5 major sources of transmission. Skin organisms are the most common source of CLABSIs, accounting for 60% of contamination. The patient's own bacterial flora can invade at the insertion site and lead to infection. The best way to remove this transient flora is through proper skin antisepsis and allowing the solution to completely dry prior to insertion. The CDC recommends the use of a greater than 0.5% CHG and alcohol formulation for skin antisepsis prior to central line insertion and for ongoing maintenance. The second potential route of infection is contamination of the catheter hub or needleless access site, which accounts for approximately 12% of CLABSIs. Central lines serve as a direct route into the patient's vascular system. The access site of the line is a high-risk area and demands special attention. To prevent contamination, hand hygiene must be performed prior to accessing the device. In addition, needleless access sites must be disinfected prior to use and between each access, as recently reinforced by the Infusion Nurses Society. Some studies have shown that disinfection of the devices with chlorhexidine alcohol solutions appears to be most effective in reducing colonization. Contamination of the infusate is quite uncommon, occurring only about 1% of the time, and it is usually traced back to the manufacturing process. Clinicians should use best practices and handle products, such as IV fluids, aseptically and according to packaging instructions. The final 2 sources of transmission account for 27% of CLABSIs. Contamination of the device prior to insertion is the 4th way an infection can enter a central line. This occurs when the clinician accidentally contaminates the sterile item. Lack of compliance to aseptic technique is the main cause of this contamination. More rarely, it can occur during the manufacturing process. All supplies should be handled aseptically. Finally, the last infection opportunity takes place hematogenously. This occurs when an infection elsewhere in the patient travels by blood to the insertion site of a vascular access catheter. This causes significant risk to the patient and could cause sepsis. The total impact of CLABSIs on patients and their families can't be fully measured. However, the negative results are easily linked to increased length of hospital stays, the need to use increasingly more potent antibiotics, transfer to a higher level of care, such as an ICU, or in some cases sepsis, and in the worst cases, even death. Even though these central line-associated bloodstream infections are serious, they can often be prevented. To learn more about preventing CLABSIs, visit pdihc.com.